Good afternoon, everybody. Thank you, Dr. Rajananand, Chief Instructor, who has given me this opportunity to say something on women ophthalmology after the age of 60 years. So these are the women pioneers in ophthalmology, and my slide will be incomplete if I do not mention these women who paved the way for all of us to take up this profession. And these are the women ophthalmologists, Indian women ophthalmologists. Now, I am also 61 years old and I am in government job. My age of retirement is 65. So, there is a little chance of taking early retirement or voluntary retirement earlier. So, I will have to continue it up to 65 years. And after that, there are so many options for us. So at the age of 60, we have some privileges and also we have some challenges also. Let me say the privileges. We can continue doing surgeries as an experienced and established surgeon. We can join teaching institute and invest in academics. We can afford free time for travel and leisurely activities, but less stress at work now. Now we can have the relative freedom to choose working hours. We can invest in and opening our own clinic. We can practice as a medical ophthalmologist also if we cannot do surgeries due to the various reasons, and we can open a YouTube channel now. So eye surgeries being the microscopic surgeries and relatively short procedures for most part does not take a huge toll on our body. All these years of invaluable experience and vast treasure trove of knowledge ensures that we can manage any tricky and untoward situation or disease with utmost ease. And if in any untoward situation, unfortunate event of being unable to do or unwilling to perform surgeries later in the life, we have always the option to perform exclusively as a clinical ophthalmologist. It's a privilege when compared to the other surgical specialties. Does not take away the priceless joy of diagnosing and treating patients for a vast majority of the disease that do not generally require surgical management at all. The joy of teaching. So if teaching gives immense joy, we can join a teaching institute and teach the budding ophthalmologists, both academics and practical part of this branch, creates legacy of own and attain the respect of the fellow ophthalmologists and doctors. We can enjoy travel and leisurely activities also. Already Rajan has told, the personal practice and working hours can be adjusted to make time for investing time in probable long lost hobbies. These can include travel, photography, music, and anything that makes life worth of enjoying to us. If someone is comfortable with it, she can even take voluntary early retirement and invest full time in things like traveling to various countries and enroll in extracurricular skill courses. They open a YouTube channel. It's a very good option in the modern internet age, especially after the COVID period. Advantage of recording from the comfort of one's home. Minimum investment in the setup equipment, can be educational based video channel for the medical student, can be an informative video in simple language for the common people also about the common disease and the procedures, and also we can use it for the awareness program also like glaucoma or age related macular degeneration, what are the symptoms, when to come to a doctor for consultation. It can be used as a promotional platform for one's own clinic also. Next, we can invest to open a own clinic, but this is only when I have much capital and also the next generation is ophthalmologist. Relative freedom for doing work. Being a senior ophthalmologist, generally we have the privilege of relative freedom of choosing working hours. Now we have more time for our family, which have been neglected a lot of over years in the process of honing our skills and excelling in career. In all probability, there will be much less exposure to workplace stress, which was the norm in our early career. So these are the options after the age of 60, but we also have some challenges now. The low representation in the leadership position, the breaks in the career, it hampers the surgical skill, low proportion of the women editor, long working hours can be physically debilitating, disrespectful behavior at the workplace sometimes, physical challenges of microscopic surgery for long hours. So in conclusion, I want to say we cannot change what we are not aware of, and once we are aware, we cannot help but change. Thank you.
Thank you, Dr. Mousumi. Why were you so nervous and afraid? Such a beautiful talk.